I feel like every industry has experienced fragmentation in many forms, but it does feel like healthcare has experienced it the longest and the worst. And I think of fragmentation in many different layers. It's a very complex problem in healthcare. At the very baseline, it's fragmentation in access and services and equality. It's fragmentation in the way healthcare is navigated, especially in the US, but also in other markets. And that fragmentation creates chaos, friction, and sometimes even severe outcomes for the consumers and patients that are trying to get healthcare and the impact that the healthcare has on their lives. And so all these layers really add up to a complexity that requires all players to be aligned on how to solve for this. The incentive is there for everyone to solve for this, but the success story has still been very kind of few and far between.
Right now, fragmentation, that burden of fragmentation is being felt by the customer. And of course, we know that healthcare comes in many pieces, and that's okay. That's part of our system within whether you're in the United States or elsewhere. But the customer is left putting all those puzzle pieces together to drive a picture of their health, whereas we want the industry and the stakeholders in healthcare to help paint the picture for the customer and shift that burden away from the customer back to the larger stakeholders who are better positioned to help customers really navigate what's happening within healthcare and how they can make healthier decisions best aligned with their needs and preferences.
Some of the things that become better are that organized confusion transforms into more healthy competition, where choice it replaces confusion, right, for those end consumers, end customers, and many times the professionals that are trying to help them along the journey as well.
And as a customer joining a group health plan, I may get 2, 3, 4, 5, 10 communications per week from that entity. And that creates a lot of frustration and pain in terms of understanding, well, what should I look for? How should I prioritize all these communications? And instead, the individual is left fending for themselves in many ways.
When you think about what health plans have to do, which is think about measuring the quality of the care, how they reimburse, who gets reimbursed, there's a huge position there with kind of commanding the incentive end of healthcare to influencing how fragmentation can be handled in the experience, which then drives down to what standards should be adopted. And then from the supply side, it's responsibility, nay, accountability, right, for device manufacturers, medicine manufacturers, other organizations on sort of the supply side to think about early adoption, right, of standards, to think about defragmentation as part of the things that they bring to market, like make it almost embedded, right, by design in the way they approach things. And so that creates the collaboration opportunities with the likes of the payers who can be seen as the kind of the natural chaperones of moving us from fragmentation to healthy competition.